Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Let me ask you a question about masks. I sent you an article that questioned the evidence about masks that says it's a little shaky. What is the expert conclusion on masks and how well they work?
It's not shaky at all. It is absolutely indisputable that wearing masks helps prevent getting infected and helps an infected person not transmit it to other people. There's absolutely no question about this mask thing. This issue, it keeps coming up all the time. Now, there's a difference between the type of masks. The regular little cotton masks that you see a lot of people wearing, some of them are better than others because it's all about the layers and how dense the fibers are. The surgical little blue masks that you see all the medical people typically wearing are better. And they call the N95, that really tight-fitting mask, is the best, but it's too difficult to wear all the time. So, get the best mask you can and wear it. It works. There's absolutely no doubt that it works. It does work.
There was an op-ed in the Washington Post yesterday by a doctor who says he doesn't think boosters, there's no evidence that they're actually going to work, these booster shots, and we should save them for the people who haven't gotten any vaccine shots yet. What's your thought about the boosters and the evidence?
Okay, Robin, this is going to be this medical debate now between scientists and practitioners about when you're supposed to get this booster. Now, you got three of the top people in the United States public health government all saying, hey, it's time to get the booster program going. You can debate the best time to start that, but I'll tell you one thing, you don't want to do it late, because then you're going to be basically counting more people in the hospital, more younger people in the hospital, and more people dying who are fully vaccinated. We know we need a booster.
Yeah.
There is enough evidence now to support that we start the booster program right now. We don't want to be behind this on this one.
Yeah.
Also a story in the New York Times today that those plastic barriers that they're putting up to prevent COVID spread might be more harmful. Is that true?
Yeah, I know it doesn't make any sense, but hey, they did the science. And what the plastic barriers do is they inhibit and they change the airflow in a room. Little particles can go over. They don't really block anything. They just sort of change the way the air flows. And maybe this is actually not so good. And they've actually shown in a couple studies now that having those barriers actually may be detrimental.
All right.
I think we need to stick with what we know works: social distancing and the masks and vaccines.
Let's get to viewer questions. I'm 69 and immune compromised. I just got my booster at CVS. Can I still get and pass on the variants? Plus, do I still need to wear a mask everywhere?
Yeah, no, this is a very important question. Yes, you can still get it, but your risk, because you took the booster, has just dropped significantly. So that's good for you. But it's because of the Delta variant and because the pandemic is out of control in this fourth wave, you have to still wear a mask.
All right, next question. There was an article showing breakthrough hospitalizations and, even more concerning, deaths of fully vaccinated individuals are rising. In the past week, 25% of those who died from the virus were reported as fully vaccinated. Dr. Murphy, what are your thoughts?
Yeah, no, this is happening. They showed the same thing in Israel. The French have shown it, the Germans, and now we're reporting it. Now, the people who are fully vaccinated, who are getting sick and landing in the hospital, as of today anyway, are mostly older people with underlying medical conditions. They're fragile. So the vaccine is not working as good for them. And this is another reason why older and more fragile people need to get that booster. And for immunocompromised patients, it's approved as of today. Other people are just walking in, getting a booster on their own. The full approval for the booster is likely to be in the next couple of weeks by the FDA.
All right.
All right. Last year around Valentine's Day, we had COVID-19, and then in the last 3 weeks, I have suffered several mini strokes. We were vaccinated with Moderna back in February this year. Is there any evidence of strokes from the COVID-19 vaccine?
This is a complicated question. Don't really have the full answer. I can tell you this. There have been strokes associated and other neurologic problems with COVID. There's all sorts of blood clotting issues with COVID itself, probably worse than anything with the vaccine. We do know with the Johnson & Johnson vaccine that in men over 50 in particular and women under 50 have a very slight increased incidence of blood clots that can be in the brain and cause little strokes. I would suggest that this person fills out the FDA VAERS form, VAERS, and reports it to the FDA, because if people think that it could possibly be related, we won't know as a whole group, as a whole nation, if this is really real unless it gets reported. So you or your doctor should fill that report out.
All right, if you didn't get your question answered by Dr. Murphy, he answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or go to our Morning News Facebook page and post one there. We'll talk to him again on Monday. Have a good weekend.
Have a great weekend.
Thanks, Doctor.